Well, persistent and excruciating pain along the lower back may actually be pointing at a far more serious issue higher up in the body. What doctors say could be a symptom of the tear in the aorta, a major heart artery that sends blood to other parts of the body.
And the National University Heart Centre says early detection can save lives and is offering 1,000 people free screenings. Program head Dr. Rajesh Dharmaraj joins us right now, together with Donald Teo, a patient of Dr. Rajesh.
Thank you.
Let's start with you, Mr. Teo. We discussed this briefly before we came on air. You had this problem overnight. You saw a GP, you went for an X-ray, and very quickly, relatively quickly, you were diagnosed with this aortic aneurysm.
Yes, it was, at first he's not too sure on that part, but when I was told to put up with, my wife brought me all the way up to the A&E, that's where I met Professor. And this Professor Rajesh has done all the checks, and he says that I need that surgery straight away. Yeah.
So, Mr. Teo, help us understand this excruciating pain that you felt in your lower back. What kind of a pain was it, and how long, could you put up with the pain before you decided I need serious help?
It was more unbearable than just the normal back pain. It was like piercing, and it's constantly piercing, and I couldn't rest. I couldn't sleep properly. And it lasted the whole night till morning, and I couldn't take it anymore. With all the painkillers also doesn't help. And that's where I finally agreed to see the doctor, yeah.
Oh, Dr. or Professor Rajesh.
Dr. Rajesh, yeah, thanks.
All right. We mentioned tear earlier, but to be honest, I Googled this because I know nothing about it. Aortic aneurysm is a balloon-like bulge in the aorta. So.
Yeah.
A bulge or a tear? Just clarify this for us.
The bulge is not emergency. So aorta is the main artery, as you said, which carries blood and is pressurized. So what happens is if there is some predisposing condition which leads to the weakness in the walls, it slowly dilates because of the inside pressure. It's just like a balloon. So what happens to a balloon? It reaches a point of time when it expands, the wall cannot hold the blood within it, and it starts leaking. The first is a leak, and next is a rupture. So when Mr. Donald had the pain, he was actually having a leak. That means blood was leaking outside the artery.
Perhaps you could show us, you brought with you, right,
Yep.
a sample of what it looks like.
So this is basically showing the the abdominal part of the aorta. So aorta comes from the heart, goes up, supplies the head and neck, then the thorax, and then comes to the abdomen, then divides into two arteries which supplies the legs. So these are the kidney vessels up here. So you can see the bulge here. This is not normal. So it should be one straight pipe. Okay. So in some patients, this is the most common area where it bulges. And the normal size in Asian population, I would say, is about 1.5 centimeter. Okay. In Mr. Donald's case, it was 8 centimeter. Wow. So you see the size, it has grown enormously. And until that, it cannot hold anymore the pressure of blood inside.
So in our earlier conversations as well, Mr. Teo said that it doesn't run in his family. So is this particular condition hereditary, or is it due to a poor diet?
Okay.
How can you prevent it?
There are some genetic causes to it, but that's in those patients you'll see the aneurysm are coming up in much early in the life, like 20s and 30s, like Marfan syndrome. But what we see in Mr. Teo's case is a degenerative one. That means because of his risk factors. His sex itself is a risk factor. Male, it's more common in males. Smoking, hypertension, that's the most common cause for him having this condition. The most important thing is he does not know he had the condition, right? And it grew from maybe 1.5 centimeter, 8 centimeter over. It grows over a matter of years. It's not days or months. So he had it within him, and he was looking fine and healthy until the day when it starts leaking and may burst. And when that happens, most of the patients even don't make it to the hospital if it happens outside the hospital. So we don't see some of the patients, we don't know when they die.
So when this rupture happens and they're not treated, they don't go to hospital, it's potentially fatal, is it not?
Yes, 100% fatal.
Yes.
100%. If you don't treat it, it's a very time-sensitive issue. That's why I think we saw Mr. Teo came to ED about 11. I think he was on operating table by 12:30.
Wow.
So that's the speed. We stop everything to do this.
So the treatment, I read that off your little
Yeah.
graphic there. It's a stent graft. So a
So there are two
rupture,
ways of-
how does this work?
So there are two ways of treating it. Basically, it's a pipe which is, kind of degraded itself. So we need to replace the pipe, all right? So we can do either open surgery. Open surgery is you cut open his stomach, stop the blood flow up and below, replace, sew it with a graft. The one Mr. Donald had is a newer keyhole method where he had this it's actually a three-piece stent. You can actually see like a trouser here, but it's not one piece, it's three-piece. It's built over here inside the body, and it's put through his legs. So very small cuts, about 1 centimeter cuts through the groin. We insert a stent under local anesthesia. So that made a difference in his recovery.
Yeah.
He was able to, I think, go out of the hospital within a week.
Yes, 7 days to be exact. And after that, I rested for 5 days. And I've gone back for the second op for the coils for 4 days in hospital. So total,
So in
that's
terms
about
of
11
follow-up,
days. Yeah.
follow-up appointments with Dr. Rajesh, what are you looking out for? What are the potential
So-
complications?
So the main thing we look for is the stent is in good position, there is no leak, there's no further dilatation in the aorta, and it's shrinking in size. Shrinking is a good size. So now Mr. Donald is seeing me, I think, almost 2 years. When he started, it was more than 8 centimeter. It's come to now 4 centimeter.
So, Mr. Teo, in terms of like going back to your normal activities, whether it's exercise, walking, that sort of thing, how long before you actually managed to be yourself again?
I took like a month to recuperate, and I joined the gym, but not vigorous exercises at that moment on time. And I do have to do a lot of walking, complete good exercise, but not with heavy objects and all, for the time being.
Dr. Rajesh, we were talking earlier about how, at UHC, you're actually offering free
Yep.
screening. So firstly, who are the candidates who should be going for such screenings? And also, what can they expect when they...
So again, we are just looking at high-risk population where you most likely to find patients with aneurysms. So we are looking at males who are more than 65 years, who are past smokers or current smokers, and who are hypertension, and with some kind of artery disease like a peripheral artery disease or a coronary artery disease. So these are the patients who will be recruited over a period of 1 year. We are looking at 1,000 patients. That's the power we calculated to reach a reasonable,
Well, I take it this
conclusion.
free screening for 1,000 people is a pilot kind of thing. So
Yeah.
longer term, what are you looking for? For men above 65, I think the NHS, they screen women above 70. So
Yes.
longer time scale, what are you planning for men and women, and what kind of follow-up treatment and screening?
So if the study shows that screening is helpful, then there's a case to put it in the wider population. There's a case for MOH to act on it. So it is a big study which is powered well to answer this question, and then whether we can put it to the population as health screening. Yeah, that'll be beneficial in the end. All the Western world, they do it, but we don't have enough data from Asia.
Thanks so much for joining us,
Thank you.
gentlemen. We've been speaking on aortic aneurysms with Dr. Rajesh Dharmaraj at the National University Health Centre, Singapore, and Donald Teo, who survived a rupture.